Hello, welcome to Trach Talk. I'm Daryl with your Respiratory Therapy Department. There's been a change in the tracheostomy brand that we are using. We are now using Shiley tracheostomy tubes. And here in education, we have decided that it's best to look at our processes, optimize them, and offer a little training. So first off, let's talk about what is a tracheostomy. This is your standard tracheostomy right here. You have our patient's upper airway here at their mouth, and then their nose brings air in through your larynx, through underneath your epiglottis, through your larynx, and down your trachea. Your tracheostomy tube is an artificial airway that gets installed through the neck into the trachea, and it can take several forms, whether it's a cuffed trach, an uncuffed trach, or a laryngectomy, which we'll go over in just a moment. So if you have a cuffed trach, you can use this pilot balloon right here, or if you're looking at a real tracheostomy, this is your pilot balloon to put air into it, inflate the cuff, and do positive pressure ventilation through it. An uncuffed trach looks like this. It has no cuff. This little balloon is not here, and the patient can breathe much more easily through this tracheostomy tube and pass the tube up through their upper airway. This is a weaning tool to help get them off of their trach, but still be able to use a BiPAP at night sometimes through their trach, or use it for mucus clearance. Another type of tracheostomy is a laryngectomy. So here is before a laryngectomy, a normal airway. We have the upper airway here where we breathe in and comes down through your pharynx, underneath your epiglottis, and down into your trachea. Right here is your esophagus. So when the epiglottis closes, you can swallow and closes off your airway. When you are breathing, your epiglottis opens and you breathe through your trachea. Over here is a post-laryngectomy patient where they have removed their larynx and epiglottis. So the only thing connected to the patient's upper airway is their esophagus. This is very important to know what kind of trach that your patient has, whether it's a regular tracheostomy or a laryngectomy. If you had an emergency and this patient had to get bagged, if you put a mask over this patient, their mouth and nose are only connected to their esophagus. No air will go into their lungs. Some patients have a little speaking shunt placed right here. And they may be able to speak, but that doesn't mean that they can be ventilated through their mouth and nose. Ask your respiratory therapist or consult their chart to find out what kind of tracheostomy your patient has. So let's go over real quickly what the differences are and what to spot on your tracheostomy on our new device here. So right here is an old style Shiley. You may remember this. The inner cannula comes out like this. It's kind of a pain. The whole thing is is pretty stiff, and this is kind of hard to click in. The new Shileys have this nice, easy inner cannula. It's a little bit more flexible. The flange is flexible and clear. But the most important thing I want to bring to your attention is what size tracheostomy you have. So if you contact your RT and say, hey, I need a backup trach for my patient, or a size down, you tell your therapist what you have. Draw attention to this little colored dot right here. This one is a blue dot. This one is a green dot. Just tell your RT, hey, my patient has a green tracheostomy, and that will tell us what size that it is. It is color-coded specifically to this. So these numbers mean a lot of complicated things. I won't get into it. That's for your RT to know. If you want to know about it, your RT can tell you about it. Most important thing is this color. Tell your RT that that's what you need. So let's say you have a tracheostomy patient. What do? So if this patient just comes up to your floor, you need to get some emergency supplies up in there and make sure that the right order set is put in for them. What do? So in Cerner, go to Power Orders, and you need to order Guide Tracheostomy Care. This will generate a task in the task list that nursing and RT can both see that says that will show whether your tracheostomy care has been done for that shift. Pretty easy to do. What is your RT's responsibility in all this? What is your RT going to do for you? Your RT will bring up the following supplies and put this tracheostomy safety card up into the patient's room. And it will be laminated, and your RT will put up there what size trach that they have. What type of trach? Is it a cuffed trach, an uncuffed trach, or a laryngectomy? What is safe suction? We will go over safe suction in another training video. Is there intercannula disposable, or is it one that is supposed to be cleaned, or is that not applicable? What are we providing here at the bedside? Your RT will bring up a resuscitation bag and make sure that that is placed at the bedside. Replacement trach tube, so whether we're putting one of the same size or a size down, or if it's not applicable to have a size down, we won't put that there. We'll check this not applicable box. Spare trach ties and intercannulas, or if your trach does not have an intercannula, we'll check not applicable. Well, hopefully this has been informative. See me next time for more training on emergency management and tracheostomy care. Have a great day.